Yesterday was a session where I was chairing, so I introduced the topic of stacking the odds against cancer recurrence and looking at lifestyle interventions. And this is a very topical area because as more and more people survive cancer, we're looking at ways not just to survive the disease but actually live well. And we know that many patients or many people who've been diagnosed are living with other comorbidities. They're older in years, so they often have existing heart disease or diabetes. They often have experienced treatment side effects, issues of mental health and well-being and quality of life. And all of these are relevant with respect to lifestyle. But what we don't know is the magnitude of effect that lifestyle has on these outcomes. So running lifestyle trials is really the challenge of the symposium. And we had three speakers: John Saxton from the University of Northumbria, who's an exercise specialist; Jennifer Ligabell from the Dana-Farber Institute in Boston. She's an oncologist with an interest in weight management. And our final speaker was Rune Bloemhof, who's a professor of nutrition at the University of Oslo with an interest in diet and colorectal cancer survivors. So these three presenters told us their story about the evidence that supported the interventions that they are running, but also the difficulties, the realities of getting funding for lifestyle trials, because we compete with drug trials, we compete with funding for other aspects of cancer care. It's a very difficult area to get funding for, although we hear a patient voice saying, we want to know more about what we should and shouldn't do about lifestyle. So we know that there's a lot of support for this, and these three presenters are lucky enough to get funding for really quite large trials, and they're really paving the way for what goes forward. So the first, Jennifer's trial on weight management in women who've had breast cancer diagnosis, principally through diet but with activity as well. And that's recruiting at the moment, so it's a 3-year follow-up, so that'll take a while. And then Rune is following, giving his, advising his participants on an anti-inflammatory diet, a diet high on bioactive components. It's a very, very novel trial, and it's got a 15-year follow-up, which is excellent. And then John has done a lot of work, John Saxton has done a lot of work on physical activity and exercise, and he spoke about his trials in his interest in both colon and breast cancer. And we shared together some of the issues about getting lifestyle trials done, not least of course of which is getting health service staff to support recruitment for these trials, because many staff are still very sceptical that we should be asking patients who are they've just gone through treatment to do things like watch their diet. Shouldn't we be feeding them chocolates and doing nice things? And we've got a long way to go in terms of changing our attitude and really trying to convince people that these are very positive things that can be done, both for mental and physical health. So the discussion was good, lots of questions, and I think we felt that we got a very good insight and that we had made a case for the funders in the room that this is an area that patients want to hear about. The evidence is good, it takes time, and we've got some real experts around.